Greetings, ladies and gentlemen. Welcome to the last part of connective tissue discussion. We are saying the last part because the other part of connective tissue for blood synthesis, erythropoiesis, and all these things, I think you can read on your own. I think for now we'll try and focus on this. And so, connective tissue, you've already learned the classification. We just want to show you some illustrations for the examples. So remember, is connective tissue proper. So we have loose and dense. So for loose connective tissue, it is connective tissue proper. So loose, you can see that the fibers are loosely packed. So you can see the larger fibers, the unbranched ones and the branched ones. So the larger ones are collagen, the elastic ones will be the unbranched ones, and the reticular will be the branched ones. So where do we find this? The location is that these are widely distributed under epithelia of body or the body. So the plasma membrane that we talked about in epithelia is made up of loose connective tissue areola. So this is the illustration again. Then we have connective tissue proper, adipose. Now adipose relates to fat, and you can see even in the picture that the cells contain a lot of fat, so the nucleus is displaced to the periphery of the cell. It's not in the center but displaced at the end or periphery on the sides of the cell. This will show you that this is what the adipose tissue. And what you are going to see is that where do we find this? We find it around particular organs in the epidermis of the skin to help us regulate body temperature, around the kidneys, around the eyeballs, within the abdomen and the breasts. Then loose connective tissue proper, yes, but reticular. So remember, loose connective tissue, we have areola, we have adipose, we have reticular. Reticular, you can see it has a lot of reticular fibers, the branched ones, the thin branched ones. Where do we find this? It creates a sponge-like appearance for an organ. So which organs need a sponge-like appearance? We have lymphoid tissue for lymph nodes, the bone marrow, and the spleen. Okay. Then we have the dense. Dense because it has a lot of fibers that are tightly packed. You can see in this picture, this is dense, and the arrangement of the fibers is that they are parallel to each other, meaning they are regular in arrangement. So this is connective tissue proper, dense, but what? Regular. Where do we find this? We find this in tendons and mostly in ligaments and aponeuroses. So this is able to help withstand the pressure or the tension of forces in one direction, not in all directions. Then we have connective tissue proper, dense, but the fibers are not arranged in parallel, so they are arranged in all directions. So it is meant to help withstand tension, pressure, and forces in all directions. So where do we find this? We find this in fibrous capsules of organs and also in joints, also under the dermis of the skin, the submucosa of the digestive tract. Okay, the idea is that this arrangement of connective tissue helps us to withstand pressure and also to help organs withstand tension, torsion, and all these forces in all directions. Then we have a densely kind of connective tissue proper, where the fibers are arranged in a dense manner. They are totally packed, except these fibers are mostly what? Elastic. So where do we find this? We find these in large arteries that are supposed to withstand pressure of blood from the heart and able to stretch so that they comply with that pressure and return back their original position. So we have the large arteries like the aorta. Okay, you can see the aorta there and the aortic arch. but they are also found within certain ligaments associated with the vertebral column, within also walls of the bronchial tubes. Let's move to connective tissue, the rest. We've talked about connective tissue proper. Now we are talking about the rest. The rest, we start with cartilage. Cartilage, you can find it at the ends of bones. This one is hyaline or glassy kind of appearance of cartilage. You find this at the ends of bones, covering ends of bones, also covering the bones of the ribs. Then elastic cartilage makes part of the ears, the external part of the ear, also called the pinna, and the epiglottis. Fibrocartilage, this is the cartilage that is found in between the spine, the bones that make up our spine. Okay, so in between those discs you find fibrocartilage. Then we have bone tissue. Bone tissue, this is the strongest connective tissue. It is able to help us make the framework on which all these our body structures are anchored. So this, we find that there is calcium crystals, there are minerals and fat. Then you also find blood vessels. The cells that you find here are the osteoblasts that secrete. They are found in lacunas or spaces called lacunas, and also osteoclasts that digest the bones for bone resorption. But what we are seeing also now here is the kind of connective tissue called blood. You can see so many cells. Those are white blood cells, but the majority will be red blood cells. This is meant to support all tissues by providing nutrients, providing gases, providing hormones for their growth, minerals, and all these things, but also to help carry away the excess substances of metabolism and all these things, to help create an environment where other tissues will be able to survive. Otherwise, this is the end. You can use the slides at the end to be able to check whether you have understood or not. You have these notes in Moodle, so check. You'll be going slide by slide to check what kind of tissue this is, what kind of tissue that is, until you are able to finish all these slides. You test your understanding, and then you see if you have